Hey, this is Dr. Nick with the ECG Academy, and we're going to start a new section about premature or ectopic beats. Now, premature obviously means early, but what does ectopic mean? Ectopic beats arise from places outside the normal conduction system. So, anytime a heartbeat arises from somewhere in the atrium or in the ventricle outside of the normal circuitry, we call it an ectopic beat. And the spot where it comes from is often referred to as an ectopic focus. And so we're going to talk about where ectopic beats come from and how to recognize premature beats in the videos in this section. So you're thinking, oh no, not more action potentials. Yeah, we have to talk about the electrophysiology a little bit. And this is an action potential of a sinus nodal cell. As you know, sinus nodal cells are able to fire spontaneously because during diastole, during the part of the heart in between beats, there's this leakage of current into the cell. These positively charged ions leak into the cell, usually sodium, and that makes the inside of the cell less negative until it finally reaches this, where it's labeled negative 50 millivolts. That's known as the threshold potential. So when the cell reaches this threshold potential, that's when the action potential starts. That's when suddenly the floodgates open up and sodium, or in this case calcium, moves into the cell, making the cell positive, and then of course repolarization occurs after that. And if you label the action potential like you see in these sodium-dependent cells as phase 0, the downstroke is phase 1, the plateau is 2, and repolarization is phase 3. There's also a phase 4, and that occurs in between beats, the time known as diastole. So diastole, which is in between beats, remember, systole is the word that we use to describe when the heart is beating. So during diastole, you have this gradual increase in voltage, making it less negative, and when it reaches the threshold, it fires. Well, most cells in the heart are able to fire on their own, but it's the sinus node and the AV nodal cells that do it most rapidly. Remember, sinus nodal cells fire 60 to 80 beats per minute at rest. AV nodal cells, if you're looking at a junctional or nodal escape rhythm, we're talking 35 to 45 beats per minute. But pretty much any cell in the heart can reach its threshold and fire prematurely. And if a clump of cells in the atria or the ventricles reaches threshold and fires, what can happen is that wave of depolarization can propagate across the heart and result in a heartbeat. It would be an early heartbeat because you can't tell that it's happening unless it disturbs the timing. But in the next video, I'm going to show you how you can recognize a premature atrial beat, and subsequent videos will allow you to diagnose ventricular premature beats, and then we'll get into atrial premature beats with aberrant conduction and all sorts of other fun stuff. So fasten your seatbelts and start the next video, because this is Dr. Nick with the ECG Academy. Thanks for watching.